Hey Sarah, it's Dr. Roy. I wanted to go over your case with a short little video here to help you understand what your needs are, what we need to do to get to the finish line. We had a great chat during your initial consultation, but I think this video will help you see in your mind's eye where we're going and what we need to do to get there. Um, Starting off with diagnosis, you have a pretty severe posterior and interior crossbite. So your maxilla is in essence deficient. And what we need to do is we need to encourage growth. Even though you're an adult and you're done growing, we need to coach the skeletal structure in a direction that allows us to fix this crossbite. Good news is we have some techniques and tools that will allow us to do that. But before we talk about that, I just want to show you what we're looking to do. We want these teeth to be outside these teeth, something like this. All right, so that's more or less what the end goal should look like. And to get there, we're going to have to use a combination of tools and techniques to get there. Without getting too far ahead of ourselves, I just want to plant the seed that once we get near the end, we're going to have a conversation about how we address the fact that you're going to have a gap somewhere on the upper arch. It doesn't necessarily need to be there, but we have a space issue, which is actually fairly common. I wouldn't worry about it. It's not going to change whether or not we can do the case. It's just something we're going to have a conversation about when the time comes, and I don't want that to be a surprise. I have all kinds of tools in the toolbox to help you with that particular scenario. I wouldn't lose any sleep over it. There's, like I said, many ways to solve it, but I'm planting that seed here. In order to get to this point, we're not going to be able to use trays alone. This is not a case that Invisalign can do by itself. So you have two, maybe three options. One is we keep you in crossbite and we just make the teeth look better the way they are. I don't really advise that in great part because maximizing aesthetics with zero consideration for function is not something that gets patients the long-term outcome that they're often looking for. Not to mention, we have a beautiful opportunity to expand your palate, which is the floor of your nose. Increasing nasal breathing is always a good idea. I can't suggest, or I can't recommend enough doing it for that reason alone. So when we expand the palate, we actually improve not only your tongue posture inside by giving the tongue more space for the tongue to rest, but we also increase your ability to nasal breathe, which is our predominant and primary mode of breathing. So there's that. How do we get you there? So again, we could use Invisalign to idealize you and keep you in the crossbite and lose the opportunity to improve nasal breathing and tongue posture. But if we want to fix the crossbite, we could send you to the oral surgeon, and the oral surgeon could surgically do this, where they section the jaw and immediately put you into a proper posterior orientation. I will say that's a rather lengthy procedure, costly, and involves, I would consider, quite a bit of effort on the backside. So a rather long post-operative period. For some patients, it's the right decision. For you, I don't think we need to do that because we have I don't want to say non-surgical, but a much less surgical solution, and that's this here. This is called a MSC device. MARPI is another term for it. It's essentially a mini screw assisted expander that is very low profile, sits in your mouth. I place that for you, local anesthetic. It's very straightforward, and then we take it out when we're done. But this jack screw here allows the jaw to be expanded, giving us the expansion that we're looking for, like this. All right. What's nice in this case here is your lower teeth are actually pretty good. So we're going to straighten them, but there are cases like this where I have to do something on the lower and the upper that involves some sort of appliance like this here. So what I envision is this appliance sits in your mouth for about 3 to 4 months. Each day, well, I'll give you the prescription on how many times per week you turn that little screw. We give you a special tool. I haven't ever had a patient say this is painful. It can be uncomfortable for the first day or two. But nothing that's going to throw a wrench in your style or decrease your quality of life. Over time, we will see something to the effect of this. And that's a good thing. When we're expanding the palate, we're actually increasing the space between the front teeth, we will close that with Invisalign once we're done with that aspect of the treatment. So this is something you would have to accept. I can promise you any patient we've ever done this on has considered this a small price to pay for something that results in their aesthetics and functionality and ability to breathe being upgraded, being worth it. So that's pretty much it. Please email me any thoughts or questions. If we are going to do the palate expansion, I would need a CAT scan. Anna and Yvonne can set you up with that. We have a partner office in Augusta that can help you with that. And we can get the ball rolling as quickly as possible, or I can meet you again in person, talk on the phone, or correspond by email, whatever is easiest for you. Look forward to hearing from you soon, and I hope all is well. Take care.